it's Dr. Tom McFadden of Advanced Cosmetic Surgery. I'm here today to talk to you about laser resurfacing. Laser resurfacing is a thermal delivery technique which provides vaporization of the top layer of skin, or the epidermis, and delivers heat to the dermis underneath the second layer, which contracts the dermis, which is where most of the collagen is in the skin, and then also provides some stimulation of collagen growth down the road. I find it to be a very essential portion of what I call total facial rejuvenation in concert with a facelift or a mini facelift. Laser resurfacing is a thermal delivery method to deliver some heat to the skin in order to vaporize the top layer of skin and deliver heat to the dermis, the second layer of skin, in order to contract it and stimulate further collagen growth down the road. I find it to be the most effective anti-aging method for the skin by far, bar none. And we have several different techniques to use here. So we have loads of experience with all of the various methods. We've probably done over 10,000 laser procedures, which is far more than most other practices in the area. So we have lots of experience with that. I find it to be an essential component of what I call total facial rejuvenation, which we usually incorporate with a facelift or mini facelift technique to provide very dramatic results for many people of all ages. It usually takes about 30 to 40 minutes. In total, though, when you come for your laser procedure, it probably will take about 2 to 2.5 hours in total. The first part of that is that you get some Valium and Percocet normally, and you take that about an hour ahead of time to help relax you during for the case. And at each step along the way, we help you with the pain control. So the next step is we bring you into the room, we give you some topical anesthetic, then we give you nerve blocks, which should last about 1.5 to 2 hours. Then we blow some cold air at about the freezing level onto your skin, and that really helps negate the heat delivered from the laser. Then finally, when we're done, we put on a plastic mask, and that helps relieve the pain and helps you heal smoother and faster. That also provides an artificial skin, and so it really helps you pass over that oozy, crusty phase that you may hear about frequently and get through that very nicely. Now, nobody likes to have a mask on for 3 days, but we always insist that you do that. And again, we've done that for about 15 years now. It's been a very successful procedure for us. As far as recovery goes, you need to wear that mask for 3 days. Then that will peel off quite easily. And then we go through a couple of shower cycles where you wash with soap and water, get off that old dead skin, okay? And then you're on your way to recovery. And as long as you keep the skin moist and prevent it from drying out, everything is going to be fine. So then you're on your way to a newer, smoother, younger looking skin. As far as duration of results, it really depends on where you started. So if you were pretty bad off to start with, you may need a repeat procedure, especially in some more worn areas or more used areas like around the mouth. Around the mouth is the most often used area of the body. The eyelids are probably the second most used area of the body, and the forehead would be number 3. So those more used areas might need more touch-up. If you come in and you're 75 and you've never had anything done, it's more likely that you're going to need a little bit of touch-up to get you up to baseline everywhere. The cheeks generally respond the fastest and the best, and then the other areas, as mentioned, might need a little bit of touch-up here and there. But we have had some results that last a good 5 to 10 years. We've had some people like it so much they've come back for 3. over a period of about 10 years. And then 10 years later, they actually look younger than they did 10 years before. So the results are quite impressive. Good candidates for laser resurfacing are people who have, for laser resurfacing alone, people who have really good facial shape already, don't really need a lot of repositioning of tissue. But really anybody who is a light-skinned person who is not prone to any side effects of pigmentation issues is really a good candidate. I think that the laser resurfacing is very applicable to the large majority of patients. Thanks very much for listening to this video on laser resurfacing. Please like and subscribe and be on the lookout for more videos like this in the future.